Invitation and to be the part of this big congress is a great honor for me. So let's speak about dry eye disease. I don't have any financial interest in this presentation. Current estimates of the global prevalence of DAD range widely from 5 to 50%, and these numbers are affected by population, environment, diagnostic criteria, and many other factors. The last clinical study that involved centers from UK, France, Germany, Poland, and Saudi Arabia, that is called NESTS, demonstrated that there are up to 80% of undiagnosed cases of dry eye disease. So let's look at our practice. And I would like to share with you two clinical cases, to my mind, quite challenging for doctors. So we will speak how it is important to diagnose DAD before, but not after. The first one is patient 23 years old that complains of deterioration of vision, worsening of visual acuity at his standard contact lenses, and dryness. His long-term contact lenses user, and symptoms appeared after he started of systemic retinoids. He told that before he was diagnosed with keratoconus, both eyes, and he planned cross-linking. Visual acuity best corrected is not good, you see on the slide. And if you look at his outer refractometry, you will see higher level of astigmatism, myopic astigmatism, up to -8 on the right eye and -4 on the left one. But after cycloplegic, you will see decreasing of these figures. So this is a map of keratotopography, and you can see changes mostly on the right eye, but to some extent they are not really common because the thinning is mostly in the central part of the cornea. During slit lamp examination, we could see hyperemia of posterior margin of the eyelids and telangiectasis. Secretion of the meibomian glands are not good, and we can see hyperemia of conjunctiva and its dryness. Cornea demonstrates epitheliopathy, central opacity zone, and also in periphery. We can see some punctate opacities, and lenses are transparent and no changes on fundus. So our colleagues, they diagnosed this patient as moderate myopia, complex compound myopic astigmatism, keratopathy, local corneal opacity, and dry eye syndrome. And they recommended optical correction with glasses and to stop use of soft contact lenses, then preservative-free artificial tears with hyaluronic acid 4-6 times per day, then some gel with dexpanthenol at night time for a month, and also anti-inflammatory eye drops and repeated examination after 1 month. So we didn't discuss even a possibility of any cross-link of any treatment or surgery. And what's very impressive that after 1 month of this therapy, the best corrected visual acuity improved and increased up to almost normal on the right eye. But the most impressive is that if you look at outer refractometry, you will see that cylinder changed from -8 on the right eye up to -1.75, and on the left eye from -4.5 up to -1.25, so dramatically decreased. Then also keratotopography demonstrates improvement, and this patient continued his treatment with eye drops, that lubricants, hyaluronic acid, then anti-inflammatory eye drops, also cyclosporine, and afterward we decided that we will just follow up, and we followed up him during the 6 months with very low improvement of his status, but then after 1 month, when he stopped his systemic retinoids treatment, we invited him for examination, and then we can see the results. So his uncorrected and corrected best visual acuity improved, highly improved, and it was almost normal. His range of myopia and myopic astigmatism also dramatically changed. And if we started from minus 4.5 sphere and minus 8 cylinder, at the end we have had less sphere and almost no cylinder. So, and it was on the both eyes. His topography also was good. And if we are speaking about this guy, we have two risk factors. First is his contact lenses user for a long time, and another is that he started systemic retinoid. So a little bit about this type of treatment that mostly is for acne treatment, and usually patient takes started from dose 0.5 to 1 milligram per kilogram per day, but it increase in period. And even if we take patients with low doses of retinoids, it could influence on epithelial cells of conjunctive, basal secretion, and quality of tears. So it could influence on meibomian glands, as it mentioned in different papers, that oppressive differentiation of sebocytes of meibomian glands and their secretory function that changes composition meibomian, causing hyposecretory dysfunction. Also, from other side, it could influence on goblet-shaped cells and violation mucinous layer, and decrease density of the cells, and also then influence on intercellular contacts. In spite of this, despite of this, it also influences on their nerves. It changes nerves of cornea, and it influences on corneal sensitivity. Different results and different papers demonstrate that reception of isotretinoin correlates with indicators, decreased indicators of subbasal nervous plexus of cornea, and decreased sensitivity of cornea. So it could lead to different neurotrophic, decreasing of neurotrophic factors. If you look at, we try to summarize the pathogenesis of changes in the cornea and on the ocular surface due to systemic retinoids. We can see that it decreases lipid secretion and lead to dryness, hyperosmolarity. Then it leads to damaged epithelium and oxidative stress. From other side, it decreases neurotrophic support and leads to degeneration of subbasal nervous plexus and less blinking, lacrimation, and poor regenerative processes. Also, nerve loss integrity leads to appearance of beds and microneuroma of metabolic stress, and at the end, to weak inflammation of cornea. So, to conclude, in this case, we can say that ocular side effects of systemic isotretinoin can have serious consequences if not recognized and appropriately treated. And dry eye is the most common side effect and symptom, and can lead to side effects such as ocular inflammatory conditions and ocular infection. And it is recommended to repeat eye exams after dry eye disease treatment before taking decisions about surgery. And at the end, this guy now is stable and just take artificial tears and continue cyclosporine. And now he started discussion about maybe he will have refractive surgery, but we think and yet not agree about this situation. And another clinical case, this lady, after X-ray and chemotherapy because of cancer, and experienced significant vision loss in both eyes, pain and feeling of sand and redness. After eye exam, she was diagnosed with cataract and proposed to perform cataract surgery, but she was not diagnosed with severe dry eye disease. And after the surgery, the condition of the eyes deteriorated sharply and were prescribed non-steroid, steroid, eye drops, antibiotics, and so on, and everything only led to a worsening of the situation. You can see photophobia, blepharospasm, no lacrimation, filamentous keratitis, mixed injection of eyeballs, and if we start here video, you will see almost no lacrimation, just this lady open eyes, the tear layer is broken. And then treatment. So we prescribed soft contact lenses, changing every 3 days, then plasma. But from her son, because she had some also common diseases, and we decided not to use her own autoplasma, eyelid hygiene, doxycycline for 10 weeks, and then follow-up. Already after 4 days, almost full epithelialization, we appointed dexamethasone in descending pattern, and then added cyclosporine, and also for the night some lubricants. And after 9 days, also a contact lens was removed. After 2 months, a significant increase in visual acuity and improvement of the condition of the cornea. And currently she has only cyclosporine almost a year, artificial tear without preservatives 4-6 times per day, and you can see how changed her face and her eyes. So in this case, we would like, I will skip this because of time, and in this case, I would like to stress that it was not diagnosed in time rosacea, and we should be careful about this disease, and we can meet it more often than we can imagine. So we should pay attention to eyelids, to telangiectasia, ask about rosacea and some dermatological problem, and ask about some triggers, also how react patient on it. And in this case, if you look at consensus meeting and recommendation, we should always add cyclosporins as the first line therapy together with artificial tears and other try to avoid triggers. Sorry, I cannot. And as a summary of this case, advanced dry eye disease meets more often than is diagnosed, and mostly because of autoimmune states, full-time rosacea state after chemotherapy. It was about our case, radiation also, and other causes. Anamnesis is very important, and treatment like cyclosporine continued with artificial tears, preservative-free, on a permanent basis. At the beginning of treatment, it is recommended to use corticosteroids in descending regime for 2 to 6 weeks, and then cyclosporine, or it could be also combined at the same time. And motivated patients, they understanding necessity, long-term therapies, there is really way for success. Thank you for your attention.